Good evening, YouTube family. How is everybody doing tonight on this Thursday evening? Hopefully, everybody is doing wonderfully blessed, hanging out, chilling with their loved one. Hopefully, you also guys had a green day in the markets. I know this guy did, and hopefully, you did. This is Robin Hood of Stock Talk with Jaime G. That be me. For those of you that don't know, well, now you know. I'm the guy that brings the latest, the greatest in them stocks for your radar. So, hopefully, your account and my account can go up in them dollars, guys. Definitely not your financial advisor. If I look like him, well, I'm definitely not him. Go find yourself one. I'm joking, guys. I'm just merely sharing my thoughts and opinions as I invest in the stock market in my Robinhood account. With that being said, guys, if you guys can do me some favor, show me some mad love, and smash that like, push that notification bell so you can be notified when I come through with the latest and greatest. And it helps me out with the YouTube algo, guys. And most of all, guys, it's free. It don't cost you nothing but a couple seconds of your time to push that bell and maybe give me a thumbs up and leave a comment down below. I'd really appreciate it, guys. I'm trying to get to 100 subscribers and then to 1,000 subscribers. It'd be nice if you guys want to join me in this journey as I grow, as we grow together in subscribers, and as we grow in our accounts. Not financial advice. Alright, guys, we're just going to not too long, just long enough, as I like to say. We're going to be talking about ALTIMMUNE, which is a biopharmaceutical company currently trading for $16.85. It is a small cap company, guys. But before we do that, we're just going to briefly look at my account here, guys. I am at 14,260, guys. I am up for the day 2,961, which was 26%, and after hours another 1.2% at $157. Not too bad, huh, guys? Because just on Monday my count was at 9,000, I think 9,300, and then on Tuesday I was up like 2,400, and yesterday I was down 400, and then up like 150 after hours, and then today obviously was a good day, guys. I know the past 3 weeks we were in that correction, and man, lots of people's accounts got freaking creamed. I know mine got demolished. It was like somebody threw a bomb on it and bam, it blew up. I was down, guys, all the way down to like 9,600. And look, I'm slowly but surely grinding my way off, guys. You just dust yourself off and you keep pushing forward. But most importantly, guys, you got to have a positive attitude about it. Be headstrong, guys. You know what I mean? You can't be emotional in this, right? I mean, granted, I'll keep it real. During those 3 weeks, I was cussing and just, man, I wanted to give up. You know what I mean? Because I've never had my account dip so low, right? And it was frustrating and then discouraging. But nonetheless, guys, you just got to hang on tight and just remember what we're doing this for, man. We're striving for that financial freedom for us and our loved ones. I know I am. I don't know whatever your guys' goal and motivation is to invest in the markets, but mine is my kids. You know what I mean? I want to give them the world, right? And it costs money. And this is one of many ways to be able to give them the world, right, guys? I want to leave them something when I'm not here. But anyways, enough of all that. That's a whole different story. All right, guys, let's get it. Ticker ALT, and the company's name is ALTIMMUNE. Okay, they have like 6 drugs in the pipeline, which is freaking awesome for any pharmaceutical company, right, guys? And we're going to get into a little bit of that and a little bit of the financials and get a little bit of the technical, some of the analysis, right, guys? So put this on your radar. ALTIMMUNE Inc. is a clinical stage immune therapeutics company. The company is focused on the development of products to stimulate robust and durable immune responses for the prevention and treatment of diseases. The company's products candidates include ALT-801, Hep T cell, ALT-702, the NasoVax, and NasoShield. Hep T cell is a synthetic peptide immune therapy candidate designed to break immune intolerance in chronic hepatitis B infections. ALT-702, ATLR7-8, agonistic conjunction, is a tumor immune stimulant product candidate that has the potential to safely elicit or improve immune responses into a variety of cancer indications. NasoVax, it's an influenza vaccine candidate that stimulates multiple arms of the immune system and offers the potential to stop the infections and the spread of the flu while being easier to administer through an intranasal spray, right, through the nose. NasoShield is an nasal anthrax vaccine candidate that is designed to provide more rapid and stable production than the only approved anthrax vaccine. Um, so that's who they are, what they do, right? There's a couple more, actually, a couple more vaccines that they're working on, guys, and I'll briefly touch on those as well. So that's who they are, what they do, guys. You know what I mean? I think this is a great one to put on your radar, guys, and it's currently at like I said, at $16.88, guys. They're giving it a price target of all the way up to $80, guys. That's a 444 price increase, right? Percentage increase, man. That's a lot. So say you were to invest $1,000 and that $1,000 increases by 444%. Do the math. That's quite a bit, guys. Wall Street analysts give it a strong buy, and they give it a price target of $24 on the low, which is a 63% increase, right? $42.67 on the mean, which is 190% increase, and like I said, 444% increase, right? At that high 80% target, $80 target, right, guys? That's a pretty big return if you guys were to invest, like I said, $1,000, right? So the high price is $80 and the low is at $24, right, guys? So nonetheless, guys, it's gonna go up. You know what I mean? And it's been gradually going up. You know what I mean? I think this is a great one, right? It's a small cap, right? It's not a mid cap. It's not a major cap or penny stock. It is, though, a small cap stock. Its 52-week high is $35.10, guys. So obviously it has gone up already. It's shown its potential, right? That it can go up from being at the price that it is now, because it's shot up to $35.10, right? It's currently trading at $16.88, right? It fluctuated 14.44% from the day low of $15.03 to the day high of $17.20, and pulling back to the close of the day at $16.88, guys. In the last week, it's been up 22%. In the last month, 22%, guys. In the last week, I apologize, I'm trying to read my notes here. In the last week, up 22%. In the last month, it's up 62%. I'm trying to read my notes here. Oh no, 32%. I'm sorry. And in the last 3 months, 37%. And in the last year, 442%. Not too shabby. That's a pretty nice steady incline, as I like. You know what I mean? That's always a positive for me. Its first level of resistance is at $16.90, guys. So it's just pennies away from that first level of resistance, right, where the fight is on. Or it might just smash right past it, right? But nonetheless, it's 2 pennies away from that first level of resistance, right? That might be awesome. It did pass it earlier today, right? And it pulled back, right, guys? Because it did go up to $17.20. and you know, pulling back to that $16.88. With that second level resistance at $17.50, and that third level resistance is at $19.16, guys, or $19.16. And if it goes past that, obviously it is to the moon, as we like to say. And if you're invested in it, like me, I own 25 shares. I picked up 25 shares this morning, guys. I think it's a great one for your radar, right? But if you're invested in it, hopefully you want it to go to the moon, right? We want all our stocks to go to the moon. Because if they go to the moon, then our account goes to the moon. First level of support, 1671. Right, guys? So right now, obviously, like I said, it's sitting right in between that first level of support and that first level of resistance. But it's closer to the level of resistance than it is to that level of support. Point being is that it's on its way to go up, in my opinion, not down. That second level of support is at $14.28. And if it continues to dip anymore, guys, that third level is at $13.34. But, guys, with these drugs that it has in the pipeline, right, and it's working on COVID vaccine, 2 different, one is a COVID vaccine and the other one is called AdCOVID, which is a COVID vaccine that you spray in your nose, right? It's a nasal one as opposed to a needle. And get this, guys, it can be stored in room temperature, right? Like any other medication that you kind of get over the counter. That, you know, like kids Tylenol, for example, you can buy it and put it in the counter. Well, it's the same thing with this COVID vaccine that they are in phase 1 with, right? That they just got approval by FDA for trials 3 weeks ago. We'll get into that as well. Just wanted to throw that out there, right? Their earnings are expected to grow 57% per year. In return versus market, ALT exceeded the U.S. market, which returned to 42%, as opposed to ALTIMMUNE's 360% of which it had returned last year. They're forecasted to be profitable over the next year, which is always great. And they also, guys, are debt free. That's a very good sign in a company, right? That they are debt free. In the past 3 months, guys, over 5 million shares were bought by insiders, right? That was worth over $35 million, right, guys? That's a lot, and that's always a plus and a good sign when you have insiders, whether it's the CEO or just employees or just insiders in general. When you have them buying shares as opposed to selling shares, that's always a plus. Institutions own 38%, right? Retail investors, such as you and I, own 40%. Hedge funds own 5.1%, and inside investors own 15.4%, guys. Vanguard, Vanguard, one of the biggest institutions in the world, owns institutional investors owns $18 million worth of shares. BlackRock 14.6, Wells Fargo 2.6, Charles Schwab 1.8 million, guys. And just a couple days ago, the big dogs, you had 4 new institutional investors load the boat with shares, right, guys? They loaded the boat with where's it at here? 38,212 shares worth, guys. That's between 4 new institutional investors, right, guys? And then you had 3 existing institutional investors that also loaded the boat, right, with $130,000 worth of shares. Do the math, right, at what the price is going at, right? 3 days ago. Point that I'm making, guys, is that you have institutional investors, obviously brand new ones and existing ones, buying multiple shares, right? Just in those institutional investors that I had mentioned, right? There is millions upon millions of dollars invested in ALTIMMUNE. Guys, they obviously see the potential for profits in the near foreseeable future. And as I always say, these big dogs are not going to invest millions of their clients and their money in a company that they don't see profits in, right? Because that's the bottom line. What this is all about is making profits and making your account go up. That's why I'm putting this one on your radar. So hopefully, if you do invest in this company, it will help your company or help your account go up, guys. A lot of these companies that I make videos on, guys, they go up in price, guys. Granted, these past couple weeks we're going through a correction, guys, right? So a lot of companies were going down. They were in correction territory, right? But the point I'm making is, guys, never count me out, guys, because I do my due diligence, and as you guys should too, right? Don't just take my word or the word of any YouTuber. I don't care if they're a veteran, guys. Always do your own research, right? Don't just jump in head first into something, right? I just want to close out with this little article right here that I'm going to read from Seeking Alpha, guys. It's about the company ALTIMMUNE, right? It says, today we take our first in-depth look at ALTIMMUNE, a name that has been in the news a lot thanks to its COVID development efforts. The company has a diversified pipeline and strong analysts support it, but it's still not near the commercialization stage. A full analyst on ALTIMMUNE follows in the paragraph below. I do much more than just articles, right? Okay, it says ALTIMMUNE has taken shareholders for somewhat of a wild ride over the year. The past year, the stock has ebbed and flowed with the progress what the company is trying to make on the COVID-19 front. We take a look at this small cap that has been in the news in recent months. ALTIMMUNE is a Tier 4 development concern based out of Gainsbourg, Maryland. The shares currently go for $16.88 and sport a market capitalization at nearly $500 million. Right, it's a small cap. The company is focused on developing intranasal vaccines, which means through the nose and not given a shot in the arm, immune modeling therapies and treatment for liver disease, and has quite the diverse pipeline with the recent intent focus on coronavirus. 3 weeks ago, the FDA greenlighted an investigational new drug application, or IND, right, for AdCOVID. ALTIMMUNE's single-dose intranasal vaccine for COVID-19 enrollment is currently underway in this 180-person phase 1 trial. A full data readout from this much-watched trial should be out in second quarter of this year. Right, AdCOVID improving upon first-generation vaccine. Its greater ease and comfort of administration, right? It's a single dose. It's a simple nasal spray, right? It's not injected, right, guys? It's one dose, and it's through your nose. You know, there's millions of people that are scared of needles. One of my brothers is actually scared of needles, right? It's broader immune, right? It broader immunity. It induces neutralizing antibodies, T cells, and nasal molecular immunity. Potential to block infection and transmission, which is a plus, right? It stimulates molecular immunity at the site of viral entry, the nasal cavity, right? Room temperature, which this is major, guys. Room temperature stable for several months. Guys, there's a lot of countries that can't have expensive freezers and so on and so forth, right, guys? Like Pfizer and Moderna, they need freezers, right, guys? They require special handling, right? As opposed to this ad COVID, if it goes through and it passes, God willing it does, right? Another arsenal in our supply chain, right? Oh, my dog shit. Quit it, Bear. My dog's laying on the bed, guys. I'm making my dogs follow me everywhere. Maybe I'll throw him in the video one of these days. But anyways, guys, back to the subject. So like I was saying, that is crucial and that is major, right? That room temperature, right? It allows for distribution and deployment without refrigeration or ultra-low temperature freezers. Improved safety profile, right? It's indistinguishable, I can't even say that word, from placebo and autoimmune clinically tested vaccine platform. Durable antibody response, 13 plus months protection, right? So you have 13 months of protection with this if it goes through. God willing it does, right? Demonstrated by autoimmune's clinically tested vaccine program. One of numerous benefits around AdCOVID, should it eventually be approved, which we hope it does, right, guys, is that the product is expected to have extended stability at room temperature that would allow for cold chain free shipment of the vaccine. This is one of the current challenges with the current vaccine on the market, like I was saying, guys. A week prior to the IND approval, the shares got a bump with Autoimmune's chief science officer stated that AdCOVID could be the first vaccine to provide muscular immunity, guys. That is freaking killer. Nasal muscular immunity protects against COVID-19. A specialized immunity at the boundary of the environment and the host, including the respiratory tract, requires intranasal dosing to be stimulated in the nose, lungs, and airways, right? In non-human primates, intramuscular vaccine decreased SARS-CoV in the lungs but had no effect on infection in the nasal cavity. Nasal muscular immunity affords protection at the site of viral entry and early replication and blocks transmission by shed viruses. That is all good stuff, guys. It should be noted that the shares slumped significantly in late December when the FDA pulled the clinical hold on the IND filing for AdCOVID, right? But that was back in December, guys, so that's irrelevant, which has now been resolved. It should be noted AdCOVID has some encouraging preclinical data and has received funding from BARDA, $3.7 million for phase 1 trials, and could receive much more if the compound advances to phase 2 development. It says AdCOVID compelling preclinical data, systematic neutralizing antibodies, muscular response, muscular and system T cell response, longevity of serum antibody response, rapid recruitment of innate and adaptive immune cells into respiratory tract and drain lymphs nodes consistent with induction of muscular and systematic immunity, potent CD8 plus T cell response and lung with resident memory phenotype. Obviously, this is all medical talk, but I'm gonna say, guys, that is all positive talk, right, guys? I'm going to read a little bit more, and I'm not going to take too long, right? It's a little bit more of some other drugs in the pipeline, right, guys? This is why I'm bullish on this company, and just want to give it a little bit more, guys, and then I'll be done. I don't want to bore you with reading to death, right, guys? You guys can obviously do that on your own. Outside of AdCOVID, the company is slowly advancing some other pipeline candidates in its pipeline. ALT-801 is another potential promising early-stage candidate. The compound is peptide-based dual GL1 glucan receptor designed to treat the metabolic dysfunction that causes non-alcoholic hepatitis or NASH. Dosing for phase 1 study for the indication has recently commenced. The company has also begun a multinational phase 2 clinical trial of its candidates HepTC. The candidate is an immune therapeutic product candidate for patients chronically infected with the hepatitis B virus or HPV. HepTC cell will administer in 6 doses at 4 weeks intravenous for 24 weeks. Individuals will be followed, evaluated for safety and durability of results. First data readout from this study should be an outcome in the first half of 2022. Right, guys, and then it goes to break down what nasal shield differentiate. It's a vaccine for anthrax, guys, right? It's a single dose vaccine currently in development, right? It's faster protection, it's superior logistics, no cold chain distribution, self-administered, no injection required, right, guys? That's the nasal shield, right? They have, so like I said, my phone turned off. Where am I at? Oh man, guys, where am I at? Oh, my screen went black. No. Where am I at? Where am I at? Oh, there I am. I don't know if it went back on you guys. But anyways, guys, like I said, I could keep reading on, guys, but I'm not. I don't want to bore you to death. I just wanted to put this one, ticker ALT, autoimmune, on your radar. Currently at $16.80, guys. $16.88 with a high price target of $80, which would be a 444% increase, guys. This is Robinhood of Stock Talk with Jaime G. That be this guy who brings you the latest and the greatest, guys. If you guys can do this, if you found this video useful, if you can do me a favor, guys, destroy that like button, man, and it's free and it helps out that YouTube algo, guys. Until tomorrow, hope you guys stay green. Peace. Arato gato.